Okay, Ryan, welcome to our podcast on Becoming a Better You. So just fill everybody in on, who you are, what you do, what business you run.
Yeah, so my name is Ryan Baxter. I'm a psychiatric nurse practitioner. I own and operate a clinic in South County, Rhode Island, Baxter Behavioral Health, where we have 4 other psychiatric nurse practitioners. We work with children, adolescents, adults, and geriatric population with psychiatric needs. Some in my specialty is more neuropsychiatry, so it's autism, developmental disabilities, intellectual disabilities.
And how long have you been practicing?
Just over 8 years.
Okay. So over those 8 years, what have you seen as far as like the difference in either how we treat mental health and also the diagnoses that are coming up, right? Because beforehand, a lot of people who maybe were on the spectrum wouldn't be diagnosed.
Yeah.
Right. So kind of fill me in on.
Yeah. So, I think that, with the specialty population, there hasn't been too much of a change. Whereas, most of my patients are in group homes and things like that. What I do see a lot of, I say over the last 8 years, is more of it's over what I call like pathologizing normal behavior, pathologizing normal thoughts and things like that. So really the mental health issues have become, whereas I think people are just, how do I explain it? They think they have problems when they really don't necessarily have problems. They just don't understand that this is the way that a lot of people live their lives. And this is kind of normal. Like normal lies in a gray area. There's no black and white. And I think a lot of the population kind of rides this black and white kind of mentality where it's like all or nothing. Like I'm either happy or I'm sad.
Because we're humans. We're on a continuum of emotions.
Exactly.
And those can change from...
And they're always normal.
And so if I relate that to my physical therapy career, it's almost a sense like the doctor tells you I have this disease, arthritis. It could be, a tendinosis or whatever, tendinitis. And then we live with that label forever. I've had people who the doctor told them once that they shouldn't lift over 10 pounds.
Yeah.
It's 3 years later.
Yeah. And
they haven't lifted over, so you label yourself.
Exactly. So I think we find that a lot with things like post-traumatic stress disorder, where, there's definitely a subset of people that will have a chronic continuum as far as the disease goes, but post-traumatic stress is something you can get over too. It's not something, I guess you just learn to live with it. You're not as hypervigilant. You're not as inundated with nightmares and that hypervigilance and that anxiety. You may still live obviously with the memory of the trauma, but you come to kind of like this agreement that it's just going to be there. Whereas there's a lot of people that kind of just walk around and say, I was diagnosed with PTSD when I was 8 and they're 50. And the likelihood is that, maybe they still have some of that, but it's what we call learned helplessness to some extent. And learned helplessness is this idea that just kind of like we were saying, you provide somebody with a label, you provide somebody with this diagnosis, and then all of a sudden they kind of like make that part of who they are.
It becomes their identity.
Yeah, and it's almost not like, I don't want to say like people, in no way are they intentionally making these choices, but they're taking the advice from professionals and they're thinking that, this person that's, a doctor or whatever is telling me I have this, so therefore I have it.
Correct. And so this is one of the things I always say to people, is that I don't actually heal anybody as a physical therapist or even as a fitness coach or whatever. I just show you the confidence in me, which you absorb. You in turn heal yourself.
Of course.
Right. And so I'm very, I saw a lot of chronic pain patients, and we can talk about how when there's chronic pain, there's always a mental component.
Oh, yes.
Right. And I don't even know which one comes first.
It's very hard to say. Right.
So in circumstances. But I would be like, I had a nun come in, and she was probably about 75, wore the haddock every day. Her neck was like this, like the worst case of like neck immobility I've ever seen. Right, to the point where I was like, I need to get her neck up because it's like touching her sternum.
Yeah.
And so she comes and sees me, and I was like, we got this. And obviously, I'm not the first therapist she saw, right? And so I went deep with the massage. And like when the first day she started to lift her head up, she was sold instantly, and instantly loved me, instantly always wanted to come. Even when she passed, God rest her soul, the person who used to bring it would be like, sister loved you, right? Because I gave her
hope.
I gave her hope,
yes.
and she could use that.
Yes.
So then, what would you say is the difference between? Let's talk about children. Mm-hmm. So we have children who go through a traumatic event. There's some people who stay like that and they take that through their whole life. Mm-hmm. There's some that get over that and become extremely successful. And almost use that as probably like the contrast to bounce into something else. Yeah. What's the difference that in those two children?
So some of it, first of all, repeated trauma over a course of time is the worst. The type of trauma. So there's neglect is one of those traumas that kids just won't bounce back from to some extent, only because it really affects the neurobiology and
the brain changes.
Yeah, I mean, it kind of almost stunts development. Sexual traumas, things like that can be really hard too, as far as it, and being repeated. Like kids are just naturally resilient, sure. Right? Human beings are the only animal on this planet that can live in the coldest of cold, the hottest of hot. And different elevations and everything else, little food, lots of food, you name it. And kids are meant to be that way. They're meant to be like plastic. Like that's what we use in neurology. It's
sure.
Like this idea of neuroplasticity, that your brain is always evolving and changing and always has the opportunity to, even where there's, say, anoxia and there's a dead tissue in your brain, there still can be some development around there depending on the age of the person, the medical status, and really, quite honestly, a little bit of the psychological status as well, whether or not they're willing to put in the work to get there. So kids, typically for a child that hasn't gone through those repeated traumas, it may be just, their personality. It could be the people that they have around them.
Role
models for sure. Mentors. I'm a big advocate for mentorship and big brothers, big sisters. And I think sports,
sure.
And sports is something I always am pushing for kids. I feel like sports, no matter what, individual, team-based, is something that builds resiliency. It builds character. It allows you to set goals, learn about goal setting. These are all things that build our self-confidence. And that's what kids need. So sometimes it's just the kid that's got the personality that's like, nothing's going to keep me down. But a lot of times there's something else there. There's a role model. There's, a coach, a teammate, a dream.
So we all have scripts in life.
Sure.
What we follow,
yeah.
Right? So as a physical therapist, this is my script.
Yeah.
As a fitness coach, this is my script. So it's really about, for the kid, that would help them, if I'm understanding this correctly, is creating a new identity through sports.
Sure.
Right? So like, yes, I went through this trauma, stuff like that, but now I'm the all-star football player.
It might also be that they're just, they're able to test themselves, and a lot of the ideas that they have about themselves are proven wrong.
They break them.
Yes. So when you're abused, you have this idea that you're weak, you're not strong. I mean, it's not always like that, but you start to believe that like you almost deserved it as a child.
Right.
And then being put in a position in sports, say like, or even like martial arts, like jiu-jitsu, where you're not always going to be on top. You're not always going to be in a comfortable position. You have to learn how to be calm. You have to learn how to slow things down. I mean, that is just that is a great representation of what you need to do in the real world too.
And I think for me personally, since I started training jiu-jitsu when I was, karate when I was 8, the discipline of, and I tell us all the time, when you go to karate and stuff like that, we're making kids do push-ups, jumping jacks, stuff that they're not really going to do on their own.
Yes.
Right? But it's the discipline of going through it. It's the discipline of even doing a jiu-jitsu match and losing, mm-hmm. Right? Or like going to punch the bag, but the bag doesn't move. Mm-hmm. You learn that those defeats are temporary. Mm-hmm. That's not who I am. And even if we grappled and say you just started and I'm a black belt and you beat me, well, it doesn't mean I'm bad at jiu-jitsu. That moment in time, you were just better than me.
Exactly.
Right? So we don't keep those identities from the defeats that we have.
Yeah, and I think if you go into it with the idea that, like I'm completely green or I'm not, you have humility. I think humility in anything, but especially in like jiu-jitsu or sports, you're more willing to take that defeat and turn it into a strength. You're going to learn from it. And that is the most important thing, especially with children. Like I have this conversation with parents all the time. It's like your child's supposed to make mistakes.
We all
nonstop.
Yeah.
But especially children. Children don't have the tools. They don't have the experience. They don't have any of that stuff. Your job as a parent or an adult in their life is to just guide them. Teach them that they get up and they try again, or, teach them that they don't always know everything, or teach them that sometimes they're going to make a mistake and it's going to be a pretty big one, but they can bounce back from it. That's, there's other things that can happen with that relationship, but that's why it's really important to be able to say to a child, like, it's okay to fail, it's okay to lose, it's okay to be scared. All right, what are we going to do with that? What's the next step?
Yeah, and having that understanding that this is how I learn.
Yes.
Right?
Yeah.
So when we talk about role models too, so for me, being so young, you would always look up to these, especially in the early 90s, the karate instructors, right? Yeah. From my standpoint, they were men.
Yeah.
Right. And so I had to look up to my father, but also my instructors, and to see how I should conduct myself.
Yeah.
Right. Now I picked up a lot of good things and maybe some bad things from them, but it showed me a path of who I want to be, or maybe who I don't want to be.
Yeah.
Right. You take the good of them. So when we talk about role models for children, besides the parents, right? The parenting has to be on spot on. What is the importance of a role model for these kids outside of the family unit?
Well, I mean, kids are always going to look at their parents and the people around them, and they're going to like have some admiration, and when they're really little, for sure. But as they get older, they just kind of see parents as being like overreaching, intruding, not cool. You're never a cool parent. So these other people that are out there end up, they're just adults too. They're probably very much like, I could say for myself, me as a parent, and my kid might not look at me as like being the role model, but here's this other person, even in, it could be a professional, it could be a coach, it could be a high school kid, it could be anything. But it gives them another person to kind of lean on if they need to, and also like look up to and say, okay, these things are possible, and this is how this guy's doing it. So, I gotta just put the work in. Yeah. A lot of times, the work is what's evident.
And a lot of times the kid won't be comfortable telling the parent something.
Oh, yeah.
But might tell a high school coach that they trust.
Yeah, and even, a more extended family, cousins, uncles, things like that. They can have the same thing. I know my son is really close with my brother, who's a Marine, and he really looks up to him. And, he has a good, close relationship with him. And I think, I'm really proud of that. And I don't, feel like neglected or he's impeding on my relationship with my son. I'm just happy my son has something like that, because we all did. We all needed something like that,
even as adults.
Yes,
right. Always. So and we talk about whether it's business, personal, stuff like that. There's people who are ahead of you, which you can learn from.
Yes,
and that's one of the big things, especially in my life. It's always a learning experience.
Yes.
Sometimes you go through stuff that sucks.
Yeah, and I think that's where I'm talking about humility. That is one of. I would always be the first one to tell you I don't know something. And
so tell me about the martial arts, because you've been training with me for a decade.
9 years.
Right. What are the values? What do you think the most important values of the martial arts are for anybody, for either a kid or an adult, which you can bring into the other areas of your life?
Well, I can tell you, when I was a kid growing up, I didn't have... my father wasn't involved. I grew up pretty poor. I didn't grow up too far from here. I never could really get into martial arts because back in the 80s it was more expensive. But I looked up to Bruce Lee. Was my hero. I had all of his books. I watched all of his movies. I think what I learned from him growing up was this, this idea that you can overcome that anxiety when it comes to things like conflict. And that was always tough for me. And I think, growing up and being an adult, I still carried that with me. So, for me personally, being in jiu-jitsu has been, it's given me the ability to kind of not only just like get back to that goal setting and that mentality I had when I was like 12 or 13 years old playing football or something like that. But also gives me the opportunity to feel more in control when things aren't in control. So for me personally, like the biggest lesson I've learned is that, it's helped with my anxiety. It's helped with my ability to be a little bit more assertive and do things that I'm not comfortable doing.
And I think that's important for people to hear. So, as a neuropsychologist, I said that right?
Psychiatric Nurse Practitioner.
There we go. You said it much better than me. You still have anxiety.
Oh, yeah.
Like, that's part of life.
Oh, yeah.
So
I was nervous coming in and doing this thing.
And
I don't like. It's really hard for me like to do things where I have to speak about myself. So, but I had to take you up on the opportunity because it's a learning experience
for both of us.
Yeah, of course.
And so, since COVID,
yep,
it seems to me, just from doing what I do, that anxiety is rampant more so than before. Is that a fair statement that you've seen?
Yeah, so that has to do with a lot of the isolation that people had. Anytime there's change, there's anxiety. People deal with it in a variety of different ways. The pandemic, people lost loved ones. People are scared because of whatever they were reading online. People became more, more introverted to some extent, but more extroverted online.
Because that's the only outlet they had.
Yeah, exactly. So I'll tell you, like with with my population, like people with developmental disabilities, it really shook things up. We were all really nervous. We're like, oh man, we're changing these people's lives. Like they no longer can go to a day program. They no longer can go to Dunkin' Donuts every morning. They no longer can do all the things that they like to do and they look forward to. How are they going to handle that? Well, actually what happened was they did really, really well. Where they struggled was now getting back into the community, getting back into doing the regular routine. And that's where I see a lot of just typical people struggle as well. We came from being really introverted and isolated, and now we're expected to be social. And there's even like this idea that people almost lost how to develop social relationships. So you have a bunch of adults that have lost friends and they're like, they don't know how to make them.
And so that brings me to the point.
So that's all that anxiety.
Yes. And that brings me to the point where I can see in children now, because obviously we have young kids, stuff like that. So number one, wearing a mask all the time. And then, so a lot of our cues are nonverbal.
Oh, yeah.
So if you're developing...
Facial.
Yeah, if you're developing those skills, but that was at a time when, you couldn't, I feel like eventually... you're going to possibly be delayed in that going into as an adult.
No doubt.
Yeah.
The kids now are definitely delayed socially to some extent, depending on what their experiences have been over the last couple of years. But you've lost 2 years of, people forget, like school is beyond academic. School is it should be, in my opinion, should be more of a social event. It's about social growth. It's about personal growth. And kids lost that opportunity. So you have kids that are like in eighth, for instance, you got, kids in middle school, they're in 8th grade now, but really like, socially, they're still acting kind of like they're in 6th grade.
Yes.
Yeah. But they're in their 8th grade. I'm almost in puberty, kind of like, hormonal storm. So they're all like very impulsive and everybody wants to laugh and a little bit inappropriate sometimes. They haven't learned those social cues.
And I think we're not going to really know the result of this till 20 years later.
Oh, yeah.
So if I am a person with anxiety, everybody has that, right?
Yeah.
What are 1 or 2 things that I can do on a daily basis to help curb that? Now, for me personally, I work out just as much for the mental aspects as the physical.
Yes.
I know personally I'm less anxious and I can deal with stress a lot better, even if I do just a 15-minute workout in the morning.
Yeah.
Right? Like today was kind of my day off. I still go in and kind of do some things.
Of course.
And I'm good.
Yeah.
Right? But what 1 or 2 things that people can do if they're watching this?
So I think the first thing is to remember that anxiety is not a fire to be put out. It's about building the equipment to sustain yourself in that fire. So your goal is never to erase it. And that's where people end up in problems, where they try to gravitate towards, whether it's alcohol or they go
self-medicate.
That whole idea of self-medication is really about putting out the fire. That feeling's uncomfortable. So you want to put yourself in positions that are different, that are new, and that require you to be uncomfortable. That is how you're going to grow. Now, you can do it very extreme like David Goggins and go like, crazy. I think he's a good representation of what's possible. So exercise for sure. Not only will allow you to have the relaxation brought on by endorphins and serotonin and everything else, but once again, it's uncomfortable, right? When you're exercising, it shouldn't be so comfortable that you're not feeling like you're being challenged.
Well, if we were cavemen and nothing wasn't comfortable, you would just stay in the cave and then the T-Rex would eat you.
Exactly.
Right? Because you'd be like, that's fine.
Yeah.
So is anxiety good in some cases?
Exactly. Yes, definitely. Yep. So there's this idea of the bell curve, right? So anxiety is great up until that very top of that bell curve. And then, I draw this out sometimes for patients, but this is anxiety and the horizontal line is performance, or actually it's vice versa. But anyways, as you go more towards the right and your anxiety gets worse, your performance goes down. But there's a time where your anxiety actually increases your focus. It increases the blood flow to your muscles. It gets you ready for the fight.
So it's fight or flight.
Yes.
So anxiety is a part of.
It is. Yes.
Okay.
Yes. Yeah. So that's the fight or flight is more of the physiological manifestations of anxiety when it's we talk about this a lot in psychiatry where that could be overutilized. And that's when we run into problems. But when we're talking about the anxiety of going on stage and performing, or the anxiety of getting into a ring and boxing or something like that, those nerves are normal. Every single fighter, professional player, professional performer experiences that to some degree.
And needs it.
Because that's what puts them out there. And then they talk about flow and putting themselves in that mind state. And that's all because anxiety gets them to that point.
So to kind of relate it to my field of the physical therapy, it's kind of like inflammation.
Yes.
So inflammation is needed to heal your body.
Yes. Your
body sometimes doesn't know when to turn it off.
Exactly.
And then it runs rampant.
Yes.
And that's when you get into all these itises and stuff like that.
Yeah.
So for you then, what would you suggest people do just on a daily basis to live their best life?
Surround themselves with good people. People that are supportive and obviously not people that are bringing them down.
Did you ever hear that story about crabs in a bucket?
No. Oh, no, I don't think
so. So basically, they don't have to put a lid on a bucket of crabs because when one crab tries to go out of the bucket, the other crabs will pull them back down. Right? Yeah. So, right, they pull them back down. So you don't want the crabs around you. You don't want crabs in any reason.
No.
Unless you're eating them, I guess. But kind of the same way. Surround yourself by people who can uplift you.
Yes. And then I think another thing that people, what I find people end up in a lot of trouble with is not being honest. So not being honest with themselves about who they are, what they want, their needs, and also not being honest with the people around them with what they want, what they need. And because there's that disconnect, that creates a lot of anxiety. And that could even be like a career, like a person finds themselves, they're a teacher and they're like constantly anxious and their relationships are falling apart and stuff like that. And you unwind it and you peel it back and you realize like, okay, well, this person's not happy in their job. It's, playing into every other part of their life. They're not living the life they want or the life they think they should be living. They have all this anxiety.
Right. And from my medical physical learning, it's that spiritually, you know what you want to be doing, but you're not doing it. So there's this gap.
That's anxiety. It creates so much anxiety.
Yeah. And it really comes down to like, what do you do all day? You work. So that's why people say follow your passion, because your passion is a full kit. Mm-hmm. When you are following your passion, everything aligns. If you want to believe about the universe or you're happier. So the reason we started this podcast, and I say we as if I have multiple persons in me, but that's fine, is the fact that I was doing all this stuff and I was just like, and I was writing the kids' book and I was like, I'm not doing enough. And I knew that was my inner being being like, there's more that you can be doing. And so I actually recorded a video, which I never released. And it was me in the car. And I was like, you're not doing enough. Into my physical mind, I was like, of course you are, X, Y, Z. But I was like, I'm not fulfilled.
Yeah.
And that's why this podcast happened.
Yeah.
And this is one of the more exciting things that I've done. But it came from that place of knowing I wasn't on my path. Even though I loved my job, I wanted to do more. But being uncomfortable and then taking positive action.
Yes.
Right? And you talked about being honest with yourself. My job as a coach is, especially in fitness, is to tell people honestly where they're at.
Yes.
And that's a learned thing for me because I never want to hurt anyone's feelings.
Yeah.
But if I'm not honest with that woman about, okay, so maybe they have 50 pounds to lose and they're pre-diabetic. And they're like, no, I'm good. I just want to tone up. No, you're not good, right? Because diabetes can take, I think it's like on average, depending when you get it, 10 years off your life. That's a decade.
Yeah.
We can fix that.
I know.
But if I'm just like, okay, that's cool. Like, no, I have to sometimes be the a-hole and tell you the truth. Because listen, two things are going to happen. Either you're going to make a change or not make a change. But I'm only over here to make a change. And the other thing that could happen is you just get pissed at me and you're like, I'm going to show him. And then you lose the weight on your own.
Yeah.
Good.
Yeah.
But it takes someone like me from my profession or for you to be like, hey.
Yeah, you have to be honest. And especially, I'm always honest with my patients when it comes to where they are. My favorite line is that when I meet somebody and they're telling me about how things are going, how they deal with things, I ask them, well, how's that working out for you? And usually they make clicks and they're like, well, I'm in his office, so it's probably not working out that great. And so they end up becoming a little bit more willing to kind of be like, okay, maybe I'll try something new.
Do you find that people have sometimes they come to you and they're unwilling to change?
Oh, yes.
Can you do anything with them?
No.
Okay.
I can only be like, once again, that role model. Like I often find this with adolescents. They can be a little bit more resistant, or even more the adults, middle-aged adults. And what I do is I tell them like, listen, that's just my professional opinion. And, obviously, I want to be honest with you and everything else. And for the most part, those that don't come back, I don't know what happens to them, but those that do come back do end up starting to change because they trust me. They know I wasn't just blowing smoke up their ass.
Yeah. And one of the things that we do when I meet people, I'm like, hey, so Ryan, do you want to lose the 25 pounds on your own? Or do you want my help as a coach?
Yeah.
To get you there faster, help you through the pitfalls, get better results. No, I can do it on my own. Okay. Why are you here?
Yeah.
Right? Like, so if you don't acknowledge the fact that you need my help, I cannot help you.
Yeah.
No,
I got you.
And that's about being real with everybody. But let's get back to the martial arts for a second.
Yeah.
What do you like most about the martial arts?
What I was saying about being put in uncomfortable positions.
Hey guys, Dr. Marc here. Now I know a lot of you want to know how we get all these amazing results with our clients, and it comes down to three things. The first is fun fitness classes that burn a lot of calories. 2 is giving you an accountability coach to make sure you stay on track and get the best results. And 3 is the nutrition. Included in the nutrition is our food supplements. So we pair with Prestige Labs because I feel they're the best, they have integrity, and they get great results. These are actually the supplements that I take as well. Here's the awesome part. By clicking the link below, you can save 40% off the retail price. So you need that link to actually save 40%. If you just go to the normal site without my link, you're paying full price. Okay? So these are the supplements my clients use. If you are interested, definitely click the link below and it'll tell you all about them.